Hey, yo. May I help you?
I was in a slight accident and think a massage would make me feel much better.
This is a joke. Right, you need a hospital.
No. I am good. I will wash off the blood. Please help me. I really want a massage.
Sorry. Ma'am, I will call 911.
I don't need 911. I want a massage. I will go somewhere else. This is a massage clinic. I will find a massage school. You should have saw your face. You ever saw Scare Tactics?
I was scared all right. That was not funny.
I just finished the intake for my 3 p.m. He has a spot on his back that looks a bit off. It's an irregular shape, dark brown, and about the size of a pencil eraser.
Good catch. Did you check the absence of melanoma?
I remember a few. Asymmetry and border. This one is definitely uneven. What are the others?
The rest are color. Is it multicolored? Diameter larger than 6 millimeters? And evolving. Has it changed? If it hits those marks, it's a local contraindication. Don't touch it, and tell him to see a dermatologist.
Got it. He also mentioned he has a fungal infection on his foot. Can I just work over his socks?
No way. That's tinea pedis, athlete's foot. It's highly contagious. That's a local contraindication. You avoid the feet entirely, change your linens immediately after, and sanitize everything he touched.
My next client has really swollen ankles. She asked for a deep tissue foot massage to push the fluid out. Should I go for it?
Good that you look at their intake form.
Wait. Press your thumb into the swelling for a few seconds. Does it leave an indentation that stays there? Yeah, it looks like a little crater. Why?
That's pitting edema. It's a major red flag for congestive heart failure or kidney issues. If you push that fluid back toward the heart, you could overload her system. That is a total contraindication until she gets a doctor's note.
Whoa. So swollen doesn't always mean massage it away. Exactly. If the heart can't pump the fluid that's already there, we shouldn't be sending more its way.
My client has an ankle that is super swollen and feels hot to the touch. He says he twisted it this morning, but still wants his deep tissue work.
Hold on, Jack. If it's hot and swollen, you're looking at acute inflammation. Do you remember the 5 cardinal signs? They usually use the Latin terms on the exam.
I remember a few. Redness and heat?
Right. That's rubber, redness, and color, heat. Then there's tumor, swelling, dollar, pain, and functionalism, which is a fancy way of saying loss of function.
Oh, so if all 5 are there, I shouldn't be digging in deep?
Absolutely not. Deep tissue on an acute injury will just increase the inflammation and tissue damage. That's a local contraindication. Stick to proximal work to help with drainage, or just avoid the area until the heat is gone.
I have a client who just got off a 12-hour flight from Europe. His left calf is really sore, cramped, and a little red. He wants me to work out the note.
Stop. Do not touch that leg. That is a classic setup for a DVT, deep vein thrombosis.
A blood clot? Just because his leg is sore?
Long flights, redness, and heat in a single calf are major red flags. If you work out that knot, you could dislodge the clot. If it travels to his lungs, it becomes a pulmonary embolism, which is life-threatening.
Chill out. So, what do I do?
You refer him to the emergency room or his doctor immediately. No massage on that leg, period. Better to be safe than sorry on the exam and in real life. See the image.
Wow, that's deep. During my clinic, all the patient seemed a little off. He was confused, shaky, and his breath smelled kind of fruity, like candy.
That's a medical emergency. He's likely experiencing ketoacidosis, a complication of diabetes.
I knew he was diabetic, but I thought I just had to watch out for the peripheral neuropathy in his feet.
The neuropathy is important because he can't feel if your pressure is too deep, but the fruity breath means his blood sugar is dangerously high. He needed some water and a call for help if he didn't clear up. And always remember, for diabetics, we avoid site of injection if they just took insulin. I have 2 clients this morning with arthritis. One says her hands are stiffest in the morning, and the other says his knees just hurt after he goes for a walk. Are they the same thing?
Definitely not. You're looking at rheumatoid arthritis, RA, and osteoarthritis, OA. The Mblex loves to compare them.
Okay, so the client with the stiff morning hands, she has some redness and swelling in her knuckles. Is that the wear and tear one?
No, that's rheumatoid arthritis. It's an autoimmune disease where the body attacks the joint lining. It's systemic and usually affects joints symmetrically on both sides. During a flare-up when it's red and hot, it's a local contraindication.
So the guy with the knee pain after walking, that's the wear and tear?
Exactly. That's osteoarthritis. The cartilage is just wearing down from use. It's not usually red or hot, but it can be stiff. Massage is great for OA to help with circulation and range of motion, as long as you're gentle. Let me test you. What would you do in this case? An 80-year-old woman. She's very petite and has a bit of that kyphosis we talked about earlier. She asked for the deepest pressure I've got on her back.
Stop right there. With her age and posture, you have to assume she has osteoporosis.
That's the one where the bones get brittle and lose density, right?
Yes. Her bones are literally like honeycomb. If you use heavy elbow pressure or aggressive stretching on her spine or ribs, you could actually cause a pathological fracture.
A fracture just from a massage? That's scary.
It is. For osteoporosis, we use light to medium pressure and avoid any high-velocity movements. Safety always overrides a client's request for deeper pressure. Go on with your bad self.
I have a client coming in who says she has fibromyalgia. She's nervous because she's had massages before that left her sore for days. Fibromyalgia is a central sensitization syndrome. Their nervous system is turned up too high. What feels like medium pressure to you might feel like a 10 out of 10 pain to her. Well, some people think, no pain, no gain. So I should just do a light touch. Start very light and check in constantly. The goal with fibro is to stay below the pain threshold. If you overstimulate them, their body goes into a flare and they won't be able to sleep. When a client says he has sciatica, he is shooting pain going down the back of his right leg all the way to his calf. Is that always a disc issue? Not necessarily. That's why we assess. True sciatica is often caused by a herniated disc in the lumbar spine, but it could also be piriformis syndrome. The piriformis muscle? You mean it can squeeze a nerve? Exactly. In about 15% of people, the sciatic nerve actually passes through the piriformis muscle instead of under it. If that muscle is tight, it mimics a disc problem. We call that false sciatica. So if I relax his piriformis and the leg pain stops, it wasn't his spine? You got it. But remember, if it is a herniated disc, you have to avoid any heavy pressure or spinal twisting. That's why we stay in our scope of practice and don't tell him it's definitely your muscle. I should start calling Jack. Mr. Sciatica or Mr. Piriformis syndrome. Why you say that? Because he is a pain in my butt.
Hey, Val. What you doing?
See what I mean? Oh, he makes me sick.
I had a client today whose hand kept falling asleep during the massage. She said she gets tingling down her arm whenever she's typing.
That sounds like thoracic outlet syndrome, TOS. It's a compression of the brachial plexus and blood vessels.
Where is it getting squashed?
There are three main bottlenecks: between the scalenus, neck, under the clavicle, or under the pectoralis minor. If those muscles are tight, they choke off the nerve signals to the arm.
So if I work on her neck and chest, it might help her hand stop tingling?
Likely. But keep an eye out for carpal tunnel too. TOS happens at the neck/chest. Carpal tunnel happens at the wrist. The Mblex will ask you to differentiate between the two.
Another situation. Last one for the day, my client has those big, rapid, purple veins on the back of her calves. She asked for a deep striking massage there.
Those are varicose veins. The valves in those veins have failed, and the blood is pooling.
Is that a contraindication?
A local contraindication for deep pressure. If you use heavy pressure or hacking department on those, you could cause a blood clot to break loose or damage the vein even further. Use very light, broad strokes, effleurage toward the heart, or just avoid the area.
My 5 p.m. just arrived, and he's carrying an inhaler. He says he has emphysema, but he wants to lie prone, face down, for the whole hour because his back hurts.
Be careful with that. Emphysema is part of COPD, chronic obstructive pulmonary disease. When people with lung issues lie flat on their stomach, it makes it much harder for their respiratory muscles to expand.
Oh, right. So if he starts struggling to breathe, what should I do?
Move him into a semi-Fowler's position, propped up at a 45-degree angle. It uses gravity to help the diaphragm drop and makes breathing easier. And if he has an asthma attack, stay calm, stop the massage, and help him find his bronchodilator.
Glad I took medical massage training. I have a few more to share with you. I have a client who wants abdominal massage for bloating, but he also mentioned he has GERD. Is there a specific way I should move?
For any abdominal work, you always follow the path of the large intestine. You start at the ascending colon, right side, move to the transverse, and down the descending, left side. We call it clockwise, to match the flow of digestion.
Last time I did that, client kept passing gas. And the GERD. That's acid reflux, right?
Exactly. Avoid deep pressure near the upper abdomen, and again, keep their head slightly elevated. If you massage someone with GERD while they are flat, you might send stomach acid right back up their esophagus.
Last one. My client has a sharp, stabbing pain in his flank area, right near the lower ribs in the back. He thinks it's a muscle knot.
Check for other symptoms. Is he nauseous? Does it hurt to urinate? That sounds like renal calculi, better known as kidney stones.
You got me for a minute. I was thinking, what the heck is that? If it's a kidney stone, can I rub it out?
Absolutely not. That is a total contraindication until the stone passes or a doctor clears him. If you do percussion or deep work over the kidneys while a stone is moving, you could cause internal bleeding or extreme pain.
Alright guys, let's talk about different scenarios to see how we would deal with these situations.
My 9 a.m. has Graves' disease.
She says she feels hot all the time and her heart is racing. Is it okay to use a table warmer?
Definitely not. Graves is a form of hyperthyroidism. Her metabolism is already in overdrive. A table warmer or heavy blankets could cause her to overheat. Keep the room cool and use light, relaxing strokes.
What about the opposite? I have a client with hypothyroidism.
They are usually the ones who are freezing and have very dry skin. They'll love the table warmer. Just remember, for any endocrine disorder, the body's internal thermostat is broken, so you have to adjust the environment for them.
A client who had lymph nodes removed during cancer surgery. Her arm is really swollen. Can I use my milking strokes to move that fluid?
Stop, that's lymphedema, not regular swelling. If the nodes are gone, the drain is removed. If you push too much fluid into an area that can't drain it, you can cause tissue damage or infection.
You can chill. So I can't touch it at all?
Unless you are certified in manual lymphatic drainage (MLD), you avoid that limb. For the Mblex, remember, lymphedema is a local contraindication for standard Swedish massage because the plumbing system is physically broken.
What about a client's intake form says he has hypertension, high blood pressure? He's on medication for it. Does that change the massage?
It does. If his blood pressure is controlled by meds, it's a relative contraindication. Avoid long, vigorous strokes when the heart that might spike his pressure. Also, be careful when he sits up. He might get orthostatic hypotension, dizziness from a sudden drop in pressure.
We know you know all the fancy terms. You could have just said it in layman's terms. Orthostatic hypotension. He talks like that? And what if he starts feeling chest pain during the session?
That's angina pectoris. Stop immediately. If it doesn't go away with rest or his nitroglycerin, call 911. That's a sign of a potential myocardial infarction, heart attack. Massage therapist. Face a lot of situations.
A client who says she has ovarian cysts and her lower abdomen is very tender. Can I do some deep work to release the tension?
Absolutely not. Deep abdominal pressure on a cyst could cause it to rupture. That is a local contraindication. The same goes for the first trimester of pregnancy. We generally avoid deep abdominal work to be safe. Final question. A client comes in with a hot, red, swollen ankle that they injured 2 hours ago. What are the 5 signs of inflammation and what do you do?
Easy. Rubber, redness, calor, heat, tumor, swelling, dollar, pain, and functionalisia, loss of function. It's an acute local CI. I avoid the ankle and maybe just do some very light, proximal effleurage to help with the fluid.
You're officially a pathology pro. Done with systems pathology checkout.